This is my first time in Ireland, and I'm very eager to get to know more about Ireland, and this morning's introduction has been great for me, and I'm very excited to be here and be part of this very exciting initiative. So what I'm going to do today is to try to give you a sense of how I developed the program, what led me to develop it, a little bit about its unique characteristics, about the cooperation between outsiders, outside agencies and schools, and then the evidence that I developed of its impact. A long time ago, more than 30 years ago, I was hired by my own county, which is called Brenna County, New Jersey, to work full-time for them to develop a program to prevent adolescent problems, because people were becoming very concerned. By that time, some of the adolescent problems had not left, they expanded from the cities out to the suburbs. So people in the suburbs were becoming very concerned about what they saw the problems that their youth were developing. So my county government said we have to really focus on what to do. And so they actually hired me. I was a clinical psychologist, full-time, with the charge to develop a program which would prevent adolescent problems. Start with children who were vulnerable, do some sort of program, develop some sort of program, and then show at the end of 3 years that the program made a positive impact. And as I mentioned, they wanted this done so it would work in urban schools and suburban schools. So what my county did was make a contract with a couple schools, saying, would you be the guinea pig schools and let Brenna Bry come in and develop programs and look at the impact, and then let her come back in 3 years and tell us whether it made a difference. And for me, I was trained as a scientist, someone who was supposed to look at the evidence of what I did. And as a practitioner, it's very hard to actually do science while you're being a practitioner. So to be told that that's what I should do, do science and practice at the same time, was the reason I took this very unique job as one person working for my county to try to bring this about. And so the charge from the county was to identify at-risk youth, which already was an interesting charge. They told me I should start with what we call 7th graders, 12, 13-year-olds, and follow them through 9th grade, which is when they were beginning our high school. I was supposed to identify early, before they were showing the problems themselves, those that would be vulnerable for the problems. That was the first challenge. And then I was supposed to develop a program which would prevent these future problems. And then I was supposed to evaluate whether or not the program really did prevent them. So as a clinical psychologist, I was used to working with problems that were already developed. And so it was already a challenge to figure out how was I going to measure that I was preventing a problem. I mean, if it wasn't there now, how was I going to know that something I did kept it from happening? And really the only way to do this is with a randomized controlled trial, to work with a group of youth and then to be able to know what might have happened to them if I didn't work with them. So what I did, once I decided who the at-risk youth were, is to identify twice as many as one person could possibly work with. And then flip a coin and work with the half that I could work with, and watch what happened to the others. And that's the approach I used to develop the evidence that my program had an impact. Some people might think that sounds cold, and yet how I justified it for myself is what typically happens when a new program comes in. The first people that sign up are the ones that get it, because resources are always limited. I mean, you never can take care of everybody. Although it's kind of exciting that you've got a 95% participation in early childhood program. But in the beginning, you never can take care of everybody. And so usually it's the first parents to get their permissions in, or the first kids who are identified by somebody who gets programs. So I figured at least it's a little fairer to try to identify a large group of kids and flip a coin about which ones get in. That was the approach I used. Now, of course, the first question is, who is at risk? You know, I went into these schools, it's very friendly schools, and it was my job to look at the 7th graders and decide who should I spend my time working with to try to prevent these serious adolescent problems. And the serious problems were things like dropping out of school. We call dropping out of school, I think you call leaving early. We wanted kids to complete their school. We wanted to try to prevent students from getting involved with the juvenile justice system and getting a criminal record. We were trying to prevent substance abuse and just not completing school. And eventually, you know, unemployment, perhaps because of not completing school. So this is what we were trying to prevent. At that point, in trying to decide, of course, as a scientist, I said to them, well, I need to do a study. And they said, no, you haven't got time to do a study. In 1 month, you need to identify who you're going to work with and start working with them. So I thought, well, I've learned that in medical areas, there's this public health model where you count the number of risk factors, and then you can identify who's more at risk for heart disease or ulcers. And so I thought maybe I can apply this public health model to youth. And so maybe the youth with the highest number of risk factors are the youth who eventually will have a higher probability of developing the problems. At the time, I didn't have time to do the research, but after I worked for the county, I took an academic job and had time to actually test my hypothesis, my multiple risk factors hypothesis, by taking a data set that had already been collected and counting the number of risk factors that youth had 1 year, and then looking 3 years later to see whether the ones with the highest number of risk factors indeed had the greater number of problems. And there is indeed a very linear model. The youth with no risk factors have less than the base rate number of problems 3 years later, and those with, say, 4 risk factors had a very high probability of having developed problems 3 years later. By now, I think you probably all have heard of this model. You probably know about number of risk factors increasing the number of probability of problems, and lower risk factors not. But at the time when I was supposed to be developing this program, I was one of the first ones to apply this public health model to youth problems. So that's how I decided to identify the youth, is finding those who had, in their school presentation, a higher number of risk factors. I was trying to be very thorough, so I went through the records, the folders of every single 7th grader in the 2 different school systems to count the number of risk factors that I saw evidence for in the records. I also talked to the 7th grade teachers, and ask them,